welcome to my YouTube channel. Thank you for liking, sharing and subscribing. I urge those who have not subscribed to subscribe, to like, because I'm dedicated to give you oral health care tips for healthy gums and for health teeth. Today's video, I want to give you the replacement options for missing teeth. We have removable dentures. Removable dentures will replace from one tooth to even all teeth. That is, we have partial dentures for replacement of few teeth, and we have complete dentures for replacement of all teeth. These dentures, removable dentures, will make you to have a good speech, a good smile, and even chewing won't be a problem when you have them. They serve all that. Remember, when you don't have teeth, you might even get into depression, have low self-esteem, and affect your way of life. That's why it's always good to replace when you don't have. These removable dentures are cheap and even easy to fabricate. When they break, it's also easy to repair. The only disadvantage with them is that they can get lost. Maybe if you misplace, you have also to remove them every night. You place them in a glass of water, and in the morning you clean and put it in your mouth. Then we have the other option that we call dental bridges. For dental bridges, they are permanent and they are made when your natural teeth are prepared and help in holding the bridge in place. The tooth in this end is prepared, the other tooth in this end is prepared, and then we have the artificial tooth that will rest on the place where you have a missed tooth. Then the missing tooth, then your healthy teeth or the abutment helps to hold the bridge in place. We have the one we call traditional bridge or the conventional bridges, is that the bridge is being held in both sides. Then we have the other one that we call cantilever bridges. This one only one tooth is prepared, and then it holds the other artificial tooth in place. This one are only recommended for anterior teeth because for the front teeth, and because on the posterior region there is a lot of force in chewing, so it can easily break. Then we have the other type of dental bridge we call Maryland bridge. For Maryland bridge, a metal framework or porcelain framework is used to hold that bridge, whereby very minimal preparation is done on your front teeth. Then those metal wings are cemented and the bridge is held in place. Even this option is only for the front teeth. It cannot fit for the back teeth. And another thing, when you have large fillings on the anterior region, you cannot be fit for this Maryland bridge. The other option for dental bridges is for implant supported bridges. An implant can be inserted after surgery on your jaw, and those bridges can be supported by those implants. That's all on the dental bridges. The other option is implants, dental implants. It's a good option for teeth replacement because in implants, no tooth preparation is required. It's only a standard. Then implants are inserted on your mouth, then a crown is put on top. This one can last for many years, but if it doesn't feel, but it's very expensive. Very few people will afford dental implants. On the dental bridges, I forgot to tell you, when you have problems like periodontal diseases, poor hygiene, that bridge can come out together with your the teeth which you are holding the bridge. So that's a very common disadvantage, but dental bridges also can last for over 5 years when it's fitted properly. Then we have the last option that we call not replacing at all. There are some people who love their teeth extracted and they don't replace. This option is very bad because it has consequences like the adjacent teeth will drift, tilt, and the opposite tooth will overlap. When this happens, you will miss if the opposite tooth, you will miss even these adjacent teeth. You will have a change in bite, whereby when chewing, or you will exert a lot of force because there are contacts which are not required that will occur. Then the teeth will crack. You end up having many problems than before. So it's always good to replace. The other thing, that consequence that you will get when you want to replace is that you will age faster because you will lose the jaw bone, and then the facial profile will change, which is not very good for many of us. No one wants to age faster than the years that they are. So please, it's good to replace. The other thing that will happen is that you will have a few options for the food that you take, because like if you miss the posterior teeth or the back teeth, chewing will be a problem. So you will start getting some problems because many foods that require chewing will not be fit for you. So it's always good to go to the health care, the dental clinic, so that you can inquire on the right option for you if you have a missing tooth, so that you can be given the right option. So I always emphasize on taking care of your natural teeth, because when you brush in the morning and in the evening and you floss properly and you go for dental checkups, you will have your oral hygiene well maintained. Because when you go for checkups after every 6 months, if there is any cavity developing, it can be filled. If you have maybe calculus or plaque buildup around your gums or teeth, it can be professionally cleaned, so you need to get gingivitis or those gum diseases, and you will have a good oral hygiene tip that will give you a healthy mouth, and a healthy mouth, a healthy you. When you have a memory, research shows that when you have periodontal diseases and they are untreated, those pathogens, bacteria can get into the bloodstream and cause diabetes, cause heart diseases, and so on. So please, it's good to protect your mouth if you want to have a healthy body. Thank you for watching. Don't forget to like, share, and subscribe.